Hi friends, welcome to my YouTube channel Nursing Classes, a place where you get nursing competitive exam MCQ and theory classes. आज की इस वीडियो क्लास में हम एम्स भोपाल का क्वेश्चन सॉल्व करने जा रहे हैं। शुरू करने से पहले अगर आप लोगों ने मेरी YouTube चैनल को सब्सक्राइब नहीं किया है तो सब्सक्राइब करें और बेल आइकॉन को क्लिक करें जिससे मेरे आने वाली वीडियोस का नोटिफिकेशन पहले मिलेगा। अगर वीडियो अच्छी लगी तो एक लाइक कर देना और अपने दोस्तों के साथ शेयर करना। चलो अब शुरू करते हैं। An organic mental disorder among the following is: A. Bipolar disorder, B. Conversion disorder, C. Vascular dementia, D. Schizophrenia. Correct answer, C. Vascular dementia. 32. The behavior of a diabetic person who eats sweets regularly is an indication of: A. Fixation, B. Denial, C. Dislocation, D. Displacement. Correct answer, B. Denial. 33. The developing offspring until 8 weeks after implantation is known as: A. Fetus, B. Chorion, C. Embryo, D. Neonate. Correct answer, C. Embryo. 34. A chain of reporting ranging from the individual with the ultimate authority at the top to the one with the least authority at the bottom is called: A. Unity of command, B. Requisite authority, C. Scalar chain, D. Span of control. Correct answer, C. Scalar chain. 35. The guidelines recommended by the Center for Disease Control in 1987, which were updated in 1988 to prevent the transmission of AIDS, are called: A. Central sterilization, B. Universal precautions, C. Personal protection, D. Hospital infection control. Correct answer, B. Universal precautions. 36. Dash is completely reabsorbed by the renal tubules: A. Potassium, B. Creatinine, C. Glucose, D. Uric acid. Correct answer, C. Glucose. 37. The functional component of abducens nerve is: A. Special afferent, B. General somatic afferent, C. General somatic afferent, D. General visceral afferent. Correct answer, B. General somatic afferent. 38. Which of the following is an example of sublimation? A woman has no memory of being sexually assaulted as child. B. Blaming the teacher for failing in exams. C. Child starts bedwetting after the birth of sibling. D. A young man who is dealing with aggression by playing football. Correct answer, D. A young man who is dealing with aggression by playing football. 39. Most common type of meningitis that affects children less than 5 years: A. Aseptic meningitis, B. Bacterial meningitis, C. Tuberculous meningitis, D. Idiopathic meningitis. Correct answer, A. Aseptic meningitis. 40. From the age of 1 to 3, the stage of development is called: A. Genital stage, B. Anal stage, C. Phallic stage, D. Oral stage. Correct answer B. Anal stage. 41. The correct order of response to stress is A. Alarm reaction resistance exhaustion. B. Alarm reaction exhaustion resistance. C. Resistance alarm reaction exhaustion. D. Resistance exhaustion alarm reaction. Correct answer A. Alarm reaction resistance exhaustion. 42. Nagel's rule is used for A. Determining the expected date of delivery. B. Counting fetal heart rate. C. Evaluating amniotic fluid. D. Estimating fetal age. Correct answer A. Determining the expected date of delivery. 43. The distance from the lower border of the pubic symphysis to sacral promontory is called A. Transverse diameter. B. Diagonal conjugate. C. Oblique diameter. D. Anteroposterior diameter. Correct answer B. Diagonal conjugate. 44. The single most important technique of prevention of hospital-acquired infections is A. Surveillance system. B. Hand washing. C. Sterilization. D. Establishment of microbiological labs. Correct answer B. Hand washing. 45. A woman who has given birth 5 times or more is called A. Multipara. B. Grand multipara. C. Primipara. D. Nullipara. Correct answer B. Grand multipara. 46. Which of the following statements is true about nursing diagnosis? A. It studies the cause and effect of the illness. B. It aids in the quality of care to meet the client's needs. C. It identifies the disease. D. It predicts the prognosis. Correct answer B. It aids in the quality of care to meet the client's needs. 47. Fall risk interventions do not include A. Non-slip footwear. B. Use of restraints. C. Use of a night light. D. Sedation of a patient. Correct answer D. Sedation of a patient. 48. The single most important indicator of cardiorespiratory function in a neonate is A. Good eye contact. B. Good cry. C. Good skin color. D. Good muscle tone. Correct answer C. Good skin color. 49. Are agents that prevent the multiplication of bacteria A. Bacteriostats. B. Disinfectants. C. Bactericides. D. Antiseptics. Correct answer A. Bacteriostats. 50. The concept of self-actualization and the 15 basic personality characteristics were described. A. Maslow. B. Jehoda. C. Menninger. D. Roger. Correct answer A. Maslow. 51. The entire transitional phase between sexual maturity and menopause is called A. Menarche. B. Puberty. C. Climacteric. D. Thilache. Correct answer C. Climacteric. 52. Which of the following is not supposed to be demonstrated as a part of professionalism? A. Dishonesty. B. Integrity. C. Sense of duty. D. Transparency. Correct answer A. Dishonesty. 53. Autoclaving is an example of A. Chemical agents, B. Dry heat, C. Moist heat, D. Biological agents. Correct answer C. Moist heat. 54. The term nosocomial infection is used to refer to A. Chronic infection, B. Severe infection, C. Hospital-acquired infection, D. Untreatable infection. Correct answer C. Hospital-acquired infection. 55. The most common site of implantation of fertilized ovum is A. Posterior wall of uterus, B. Fallopian tube, C. Anterior wall of uterus, D. Fundus of uterus. Correct answer A. Posterior wall of uterus. 56. Protein synthesis is a function of A. Rough endoplasmic reticulum, B. Smooth endoplasmic reticulum, C. Mitochondria, D. Golgi apparatus. Correct answer A. Rough endoplasmic reticulum. 57. An affective disorder among the following is A. Depression, B. Delirium, C. Phobia, D. Alzheimer's. Correct answer A. Depression. 58. Edematous area in the scalp of the newborn, as a result of prolonged labor, is called A. Subdural hematoma, B. cephalhematoma, C. Intracranial bleeding, D. Caput succedaneum. Correct answer D. Caput succedaneum. 59. Clinical death is also known as A. Legal death, B. Brain death, C. Accidental death, D. Biological death. Correct answer B. Brain death. 60. Which of the following is not a method of providing regional anesthesia? A. Intravenous, B. Epidural, C. Nerve block, D. Spinal. करेक्ट आंसर ए इंट्रावीनस। कैसी लगी यह वीडियो कमेंट करके बताएं। अगर अच्छी लगी तो अपनी दोस्तों के साथ शेयर करना। एंड डोंट फॉरगेट टू सब्सक्राइब। थैंक्स फॉर वॉचिंग। सी यू इन नेक्स्ट वीडियोज।